Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors, Leo Buerger, from 1879 to 1943. Buerger's disease, thromboangiitis obliterans. Leo Buerger was born in Vienna, but his parents emigrated to the USA when he was 1 year old. He received his medical training at Columbia University, New York, and at the College of Physicians and Surgeons, graduating in 1901. He worked as surgical intern at the Lenox Hill Hospital, New York, and then at the surgical clinic in Breslau, Germany. He returned to New York, where he set up in private practice, and also worked at Mount Sinai Hospital as surgical pathologist, and also as urologist. In collaboration with F. Brown, he developed the Brown-Buerger cystoscope, which used a small electric bulb in the days long before fiber optics. He was also particularly interested in arterial disease, and in 1924 published a 628-page, lavishly illustrated monograph entitled The Circulatory Disturbances of the Extremities, including gangrene, vasomotor and trophic disorders. In 1929 he was appointed professor of urology at the College of Medical Evangelists in Los Angeles, but returned to New York in 1934. He died in 1943. In his book, he described the disease which bears his name, thromboangiitis obliterans. The patients are male, young adults and invariably heavy cigarette smokers. He considered the condition to occur particularly in Jews from Eastern Europe and Russia. We know now that the disease is worldwide, but it so happened that, in the 1920s, most of the patients at Mount Sinai, New York were Jews from Eastern Europe. There is still debate as to whether the condition represents a separate pathological entity or is a particularly severe form of arteriosclerotic arterial disease. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fahmed.